What is, very quickly, the biggest challenge you as Director of Nursing face at Homestead?
I think just the medication management, working closely with the doctors.
And you have to watch if there's some side effects to the medication.
Exactly.
Because they can't always tell you.
And there may be a time when they don't need the medications, and we may make that decision with the families to take them off some medications.
So you're in constant touch with the families?
Yeah.
It's an important aspect of Homestead Village. Nursing care, a sense of responsibility to the resident. Well, you've seen several guests on this program so far. And earlier in the show, I mentioned the security of the Homestead Village, the security of knowing that you're well taken care of. And one of the reasons for that is geriatrician Dr. Andrea Hackle, West Florida Hospital representative. And I understand you have over 140 residents who are your patients here at Homestead?
That's correct.
How do you keep them straight?
I have a lot of good help. I work with some outstanding nurse practitioners who keep the work from being overwhelming.
You know, it's very reassuring to know that there is a doctor that on a regular basis comes to the Homestead. You do come on, what, several certain days of the week, or how do you schedule that?
I have a flexible schedule that brings me out here at least a couple times a month, whereas the nurse practitioner I work with is here average 3 times a week or more.
Do the patients want to see you more than the nurse practitioner? Have you trained them well?
I think they have realistic expectations, and they're very comfortable with the way we work as a team.
Do you go to other facilities also? You do a lot of going from one to the other. You are a geriatrician. Is this what you wanted your specialty to be like?
I've done a little bit of everything in geriatrics, and I especially enjoy what I'm doing now, which is focused exclusively on long-term care. I go to assisted living facilities and nursing homes, and I find it very rewarding.
Why? What is the challenge for you, and what does it do for you?
Well, the challenge is that it's an often overlooked need in our communities to care for people in long-term care.
How long do you spend when you come out here? How long, I mean, like all day, or?
I'm usually here half a day, though the work expands to take up most of the full day with all the communication, the phone calls, the paperwork that's involved.
Now, Medicare will still pay for the doctor's visit like they would at the person's home?
They pay according to an assisted living facility code. It's not the same as a home visit.
Okay. Do you find that you have to also take care of the families as well as the resident? When you come out here, the family wants to talk with you. They want to call you. What is your relationship with the family in relation to a resident?
Well, I hope the families feel that they have a close relationship with me and the nurse practitioner, that they're always invited to feel free to communicate any questions, concerns, and we do a lot of phone interventions.
Now, you are associated with West Florida Hospital. Do all of the residents whom you see, do they have to be West Florida Hospital patients, or can they still have an allegiance to other hospitals?
They certainly can have an allegiance to any hospital of their choice.
Why did you pick geriatrics as your specialty?
Well, there's a need for a certain amount of patience and just interest in the problems of senior folks. And not everyone has it, so I recognize that as a special niche for me that I would be good at.
Well, the Homestead is so fortunate to have you here visiting their patients, and you bring brightness.
Well, thank you, Terrace.
You're quite welcome. Dr. Hackle right here at the Homestead, and she has 140 people here that she sees. Another area of security when you or your loved one is at the Homestead. But Pensacola is fortunate to have such a facility as Homestead Village, where beauty can still grow. Perhaps you learned something during this program, and if you want more information, call the Homestead Village.